All right, it's time to move into our Ask the Doc segment of the show. And our question today was, what are some of the differences between men and women when it comes to nutrition and training? And since it's Valentine's Day and we love our ladies, we're gonna focus today on the women. So, Jim, what are some of the differences in the world of nutrition specifically, and just what are some of the physiological differences that women need to be aware of?
So let's start with the physiology. And, those magic years of puberty are what begin to truly distinguish the differences between men and women. Up until that point, our bodies are fairly the same, with women progressing a little faster than men in some cases. Increased levels of testosterone in men after puberty, the guys genetically tend to have larger muscle mass, larger muscle fibers, and a lower body fat percentage. Blame it on the estrogen if you must. Men also genetically have a higher VO2 max. So there was a study out of the University of New South Wales that draws a link to the hormone estrogen and its impact on fat storage for childbearing. On average, women will have 6 to 11% more body fat than men. Studies also show that estrogen reduces a woman's ability to burn energy after eating, which can result in more fat being stored around the body. The likely reason is to prime women for childbearing, And you can see this is in the range of healthy body fat percentages between the sexes. Even if a woman is at a super lean 17% body fat percentage, the male, for example, the equivalent for male would be right around that 9% mark. And I know it seems, unfair, ladies out there, but because of this, even active women need fewer calories total, and the type of calories we ingest may differ in some cases based on our individual health.
Yeah, it definitely makes a difference. And there's some downsides to our friends and ladies that to compete, because carrying such a low body fat can change their hormone profile, unfortunately. So you'll see some ladies that are carrying that low body fat, whether it be, and it's not just competitors, it's people who are maybe super elite athletes, marathon runners, and they don't have their menstruation, so they have amenorrhea, and that can have its own versions of negative consequences in the body.
Mm-hmm. Yeah, so that leads us into like the underfueling for female athletes. And a little story about my sister. My sister Chelsea was a top level IFBB pro female figure competitor, and she's not here to kind of dive into this a little bit more, but I will say that I saw the following things I'll go into. They kind of the American College of Sports Medicine, they kind of term the following the female athlete triad, and it's a syndrome of 3 interrelated conditions that exists on a continuum of severity when a female has extremely high activity levels and extremely low body fat percentages. So often this happens when a female athlete is competitive, if their sport emphasizes leanness for performance, or when the calorie intake doesn't match energy expenditure. The following conditions include energy deficit, which can lead to disordered eating, menstrual disturbances, so amenorrhea, and bone loss or osteoporosis. The more severe the symptoms, the more dire the consequences. The ACSM notes several warning signs of underfueling athletes and potential eating disorders, among them rapid weight loss, underperformance, fatigue, stress fractures, excessive leanness, and depression. Behavioral symptoms include preoccupation with weight, food, mealtime rituals, and body image, and avoidance of team or group meals or secretive eating.
Yeah, and that's sort of why, eating disorders are fairly common in female athletes. Unfortunately, I hate to say that, but it is out there. So something we need to all be aware of. And if you're a physician like yourselves, we have to talk to our female athletes and make sure that they are getting the nutrition that they need, and they're kind of not having that psychological end. We're not qualified to be psychologists, but at the same time,
there is help out there, and
Right.
there's the website just go on and on. So if you are an athlete out there, male or female, but you're looking for some help, there's so much help out there. So just look it up. This stuff has been around for a really long time, but just now they're finding ways to, people are more open about these things too. And it kind of brings us to the Calm app with LeBron James coming on, and he's starting to talk more about his mental game being just as important as his physical preparation too. And mental health is Kevin Love. We're local here to Cleveland. He's open up about how important mental health is, and being open about the different stressors that you might be going through. So don't hold that in. Make sure you reach out there and get someone who can help you on your healthcare team.
Yeah, I think one of the biggest things I can suggest is just remember, if you're going for a specific look, you're always going to be your own worst critic. And years and years of competing, I've learned I can't look in the mirror because I don't see what other people see. I can't be my judge. I have to let somebody else look at me because I'm going to be really criticizing, and I'm not going to see certain strengths. I might see what is a strength for me is actually a weakness, and I'm sitting there telling myself one thing. So I've learned to kind of take that and twist it and say, my brain doesn't count. And that's very hard. It was a hard thing for me to do, and it's still, I'm not going to say it's perfectly easy, but I know, at least I know that my brain does that. So being aware, I think, is part of the battle. But and then in the world of training, you know, a couple big considerations with women is we talked about osteoporosis and just some quick stats on that. 200 million women worldwide experience osteoporosis, and the stats are 10% of women over 60 currently are osteoporotic, 20% of women over 70, 40% of women over 80, and 2/3, so 67% of women at age 90 will be osteoporotic. Now, that's not osteopenia, that is osteoporosis, where you have a much higher risk of fracture. So not only the nutrition becomes very important, but training. And the biggest thing that you can do is resistance training. Body weight training does count as a resistance training, so walking, doing stairs, so forth. But honestly, getting in the gym is huge. I've got a patient right now, and she's in her late 70s, and she was very hesitant to take the medicine Fosamax. Let's not get sued, but she didn't want to take her Fosamax, and she came to me and said, I know you didn't put me on this or recommend it, and I know you can't not recommend it or whatever, but I don't want to do this. What are my alternatives? So we talked about some natural supplements. There's something called Ostrofin from Standard Process, and then, you know, making sure that she has enough calcium and vitamin D. But I said, listen, you got to get in the gym. And increasing her walking, she actually had, without the drugs, increasing the walking and doing the supplementation, we did a 1-year comparison on her bone density, and she actually increased to the point where the doctors thought she was taking the medicine.
That's pretty cool.
So she's convinced that that's just not for her. She talked to her dentist as well, and the dentist was said, you know, we can't do any type of tooth surgery when you're on Fosamax because your jaw, some of the osteonecrosis of the jaw is something that's a common side effect, or at least a known side effect of some of those bone density increasing medicine. Because you got to remember where it might be putting it there somewhere else, it's going to be taking from somewhere either. So you have to be able to increase the nutritional intake and increase the resistance to the bone. That's going to be far more important than any drug that you take, unfortunately. And then
I was going to say one more thing too. You've seen like the Vibe plates and stuff like that, which can create, they claim that it can help increase calcium absorption into the bone. Quick story, down where in chiropractic school in Florida at Palmer, they had some women who were osteoporotic throughout their thoracic spine, and the ages are slipping my mind, but let's say that they were above the age of 65, and there was probably 10 to 15 women that would come in once a week and lay their T-spine, their thoracic spine, on this Vibe plate. So if you guys don't know what a Vibe plate is, there's different trade names and whatnot, but basically it's a probably about the size of this table here, maybe 3 feet by 2 feet, and something that you can stand on or you can lay on or you can stretch on. But when they turn it on, it vibrates at a certain frequency that can stimulate all kinds of cool benefits in the body. But we're just focusing on the bone regrowth here. But these women would come in and they'd lay down on their backs, put their mid back right on that, and they'd vibrate for, let's say, 5 minutes. I can't remember exactly what it was, and I don't remember the hertz that it was set on. But basically what they did was they did a study. I believe they just traced it for 3, 6, and 9 months. I don't remember us doing it for a full year. But every time that they went back and did their bone density scan, that T-spine area actually got way more, like the percentages went up for the body to absorb calcium in that area too. So for some folks who just can't get to the gym, which every excuse in the book to get there, you can accomplish some of this stuff in a matter of a few minutes. And I remember there was one lady who purchased a Vibe plate for her home, and she was just blown away by the results. So she'd do it almost every day, you know. So I don't think you guys have a couple thousand to reach in your pocket accessible right now, but if you did, it's a good option.
You know, and they're actually not even all that expensive. You can honestly get a couple of the cheaper models for in the $400 or $500 range now. So I mean, they may not be as fancy as something that you're going to get in your PT clinic or your chiro clinic, but they definitely have some that are a little bit more reasonable out there. Yeah, the big risk for osteoporosis is twofold. Number one, you're going to have compression fractures in the middle spine, and then more importantly, I think to an extent, is the hip fractures. And the reason why hip fractures become a bit more important is because the increased rate of morbidity and mortality. So most people, unfortunately, after a hip fracture, there's a high chance of death within, I believe it's 1 year or 2 years after the fracture.
A couple other things too, if we can jump, kind of piggybacking off what you mentioned on the calcium and vitamin D. When you guys, look up different recommendations, you can have the FDA, the Food and Nutrition Board. There's all kinds of different recommendations, but just basic minimum good recommendations from these websites for calcium and vitamin D, which kind of work together to help draw calcium into the bone and avoid the osteoporosis, which will actually leach calcium out and pull phosphorus back in to make your bone more spongy, not as strong as you'd like. But here's some recommendations for males and females from age 9 to 70 plus. This comes from the Food and Nutrition Board, Institute of Medicine, and National Academies. They recommend a minimum of 200 IUs a day. I personally think that's really low. I recommend, at least to my family. I won't say to my patients, maybe this is for my patients too, but I think it was always taught to us that it's safe to go for every 20 pounds of body weight you can do. I have to remember what this is actually. I have a quick brain fart. So if you're 200 pounds, you can do 10,000 IUs a day. So I can't remember what that would be. So for every 20 pounds, it's 1,000 IUs.
Yeah,
just blowing this one up. But anyway, so again, just make sure that you get something in. And as far as calcium goes, again, from the same Food and Nutrition Board, Institute of Medicine, National Academies, males between the age of 19 and 50, 1,000 milligrams a day. 51 and plus for males, 1,200 milligrams a day. And for women, 19 to 50, very similar, actually exactly the same, 1,000 milligrams a day. And then for women 50 plus, 1,200 milligrams a day. So it is important. There are some foods you can get some of this stuff in for calcium. Dairy is the most common go-to for calcium, but there are also other sources including bok choy, sesame seeds, sardines, kale, collard greens, broccoli, almonds, and more. And for vitamin D, there are some that aid in absorbing vitamin D. Fatty fish, egg yolks, and cheese were the most common.
Good old bok choy.
I know.
I've never had bok choy. I think I might know what it looks like, but haven't had it. But going real quick back to the postmenopausal women, I do want to mention, and this is, we talked a little bit about diet when Dean was on, keto versus low carb and whatnot. So I do want to just bring up a quick study that was done and published in September of 2019, so not that long ago, and this was specifically on postmenopausal women. So no offense to my keto friends out there, but in the postmenopausal over 50-year-old woman, the higher fat diets may actually increase some tumor growth and increase your risk for coronary heart disease and increased breast cancer. If you were already a breast cancer survivor, the increase of fat in the diet, and this is regardless of saturated versus unsaturated according to the study, and that's a little bit of a limitation, so we're just talking about total fat, but they were saying regardless, you do increase your risk of having reoccurrence of breast cancer, increase your risk of high blood pressure and of coronary heart disease, and also diabetes. So they found that a lower fat diet along with an increase in fruits and vegetables is going to be much better at decreasing your risk. And the study's pretty extensive, and that was done by Ross Prentice and others. So if you want to look that up, that was in the Journal of Nutrition in September of 2019. So for those of you who are on your keto diets, might not be wise to be promoting that same diet to mom or grandma.
Be interesting if they could study that, like if the person was on keto in their 20s, 30s, 40s, to see if their body was used to it versus someone just starting it later in life too.
Sure.
It's so tough because you never know who's publishing the studies, who's funding it, and this.
Well, there's always there's self-written limitations to the study, as with any good research article, which I do believe this is a pretty good one. They say, look, there's limitations to our study. We were going off of 20 plus years of data, 20 years of follow-up data, and it's like over 40,000 women in the study, so it's a very large large study, but there's some limitations, and but just be weary of people who you may want to recommend that high fat diet. Like I said, if grandma's not been super healthy in
Smoker,
her past,
drinker,
maybe some past history of cancer, you may not want to recommend the keto diet for her to be losing weight. So just something to touch on.
I'm going to fix that recommendation earlier. So quick calculation. The recommendation was for every 20 pounds of body weight, it's always been shown that 500 IUs of vitamin D would be safe. So,
Perfect.
Yeah.
Perfect.
So I know
Yeah. Sorry, Matt. It's Friday morning. It's Valentine's Day. Math is not what our strong suit is, and that's okay.
Apparently, love is.
Love. All right. So we're going to talk about our final thoughts, and I had two ideas for this, and we never really did totally nail it down on what you're going to talk about.
Let's go with the first one.
The bench.
The arching.
Okay.
Yeah.
All right. So the question is about arching during bench pressing. And as we've talked, we have this disease that chiropractors have where we're constantly analyzing people's gaits or people's lifting forms. And I got to the point one time where it went like a month where every time I was in the gym, I decided that once I was under my weight, I closed my eyes. I can't watch people because all I'm doing is doctoring them in my head or fixing their forms. And sometimes I just need to stop that distraction. But we can't help it, and it is what it is. So let's talk a little bit about the arch during a bench press. Now, let's clarify this. We are talking about arching for training, not for competition. Do you find any benefit whatsoever to an arch for your training?
I do not.
Okay.
I get the performance on the day that somebody might be doing a max bench at a competition, but still, they come back in. So let's say they compete on Saturday or Sunday. They're usually in our offices on Monday or Tuesday, like, man, something just went out in the middle of me pressing. So, I mean, I get it. You're trying to get in the most biomechanically friendly position for the chest, not the back, to press something away from you. And I just don't see it doing anything beneficial. I mean, line up 100 athletes that do that. I guarantee that over half of them would have something that next day that didn't feel right.
Yeah, it massively shortens the range. So there is a competitive only advantage to that, where you're going to shorten that range because your chest is way up and out here, and you just have this very short range of motion, and you don't have to go into a deeper chest extension where you're going to then press to get the chest flexion. You don't have to go super far, so it limits the amount of stress on the elbows, limits the amount of stress on the shoulders, but it really doesn't increase the function of the muscle. It just basically makes it a bit easier to move something from point A to point B, at the peril, unfortunately, of your spine, because we're massively loading our facets where that arch is the highest. And it has been possible, I don't want to say it's been a frequent thing, but you can actually have a fracture, a stress fracture in the facets from repetitive arching.
And I'll go one more, not as severe, but still important. You can sprain the facet joint too.
Sure.
And that people will come back in and it's almost like their adjustments, it helps, but they almost have to be patient with the body to heal, and the adjustments sometimes will be relieving, but the muscles are so locked down in protect mode that this can be something where, like, you sprain your ankle, it takes 6 to 8 weeks. This is a weight-bearing joint, or excuse me, your whole spine. So you're weight-bearing no matter what. I mean, it can take that long, if not longer, because usually when you start feeling a little better, you go right back into doing the same crappy form, and then this continues to be something that can haunt an athlete for quite some time. So yeah, I see thumbs down for this arching of the back.
Yeah, I agree. And I get it. If you're going to train, you have to be able to go at least train a little bit in how you're going to do it. But my recommendation is if you're a competitive power lifter, competitive bench presser, take your training to the point where you're doing that full range of motion, and then just maybe do only the max lifts at that arch so you can feel what it feels like to do it, and save that for competition day. But when you're doing your build up to the contest, keep that back flat on the bench, keep feet flat on the ground as much as possible, or at least as much of that back that you can get. I'll be honest, I sometimes put my feet up on the bench because it gives me more of my back flat, then I can use my arms more. But I'll be honest, at this point, I don't care how much I lift. I did my 500 pounds one time, and I don't need to ever do it again. I don't care about the amount of weight. I just want to look a certain way and be a certain level of function. So for me, that's not important. But I really, from a health standpoint and from a physiological standpoint, try to avoid that arch when you're benching unless you're right at that competition time.
I'll give you one more too. So I always try to, at least if I know someone's going to get in that position, as ugly as it may be, I'll try to give them a mobility drill that they can do in between their next set. So a cat-cow type movement where you take the spine, you're in quadruped all fours. If we could drop the camera, I'll show you. But basically, you can look this up online on YouTube, and maybe we'll shoot one for the Optimal Function YouTube page. How about that? So cat camel, nothing crazy. You're down on all fours, and I like to segmentally move the spine. You have 24 vertebrae, one at a time into flexion and extension, but it should take maybe 15 to 30 seconds to get all the way into flexion, 15 to 30 seconds to get you back into extension. But just to kind of reestablish what Craig had mentioned, the relationship between one facet to the one above or below it, to kind of help recreate that fluid gradient and to keep things a little bit more movement instead of just, you went to a position of arching. At least this can kind of help open stuff up, maybe mitigate some of the issues that you just caused a couple minutes earlier.
Yeah, imagine the worm.
Yeah,
Seeing
the wave.
worm on
Yeah.
So I think that's probably it for today, man. It was a pretty good episode. I'm glad we're back to this. I promise we won't be so long before our next episode. I'm not going to promise weekly. We still have a lot of craziness going on, and my son is in the midst of his wrestling tournaments. My daughter's in volleyball and basketball tournaments. So we can't promise weekly at this point, but we will get here a little bit more often than once every 4 months. Quick happy Valentine's Day to my lovely wife, Courtney. We'll be spending the evening with her. We're going to go out to a nice dinner. You guys doing anything?
Allie's working tonight. She doesn't know this yet, but
off.
I'm going to go surprise her. Yeah.
Nice.
I'll try to throw her off like I'm doing something at home and then just show up at work. And we'll have, we do this from time to time. We'll have like an 8 or 9 o'clock, like her lunch break, and we'll do something. So yeah, whenever this airs, hopefully I can actually get down there. So I don't want to say this and not show up.
Well,
but yeah,
we might have to edit it out if he doesn't make it.
Allie doesn't like Valentine's Day. I'll be honest with you. This isn't one of her big holidays like to celebrate. So I don't know. I always try to find something small to do just to make her feel special, because you are.
Yeah. February for me, I have the 4th is my real anniversary, my legal anniversary. I got married in Ohio, and then the 10th I got married in Punta Cana, so that was like our symbolic ceremony. Then we got Valentine's Day, and the 21st is Courtney's birthday, so I've got it all wrapped up in a matter of 3 weeks. So she's like, just buy me a car.
Yeah. There you go.
Great. No pressure.
Yep.
All right, guys. We'll see you again soon. Thanks for tuning in. Check us out on the web. Of course, optimalfunction.com. Our social media page is Optimal Function. We got everything, Facebook, Twitter, all that crap. So see you guys soon.
See you guys. Have a great week.